Hi everyone, welcome to Imaging Study. Today we are going to see a case of cholelithiasis. A middle-aged male patient came with right upper abdominal pain. Let's see what we get on ultrasound. Here's the picture of the gallbladder. You can see a hyperechogenic structure casting posterior acoustic shadow noted at the neck of the gallbladder. We changed the posture of the patient and this structure didn't move along the posture changing, which indicates that the stone is impacted at the neck of the gallbladder. The gallbladder lumen is not still distended and the wall is not thickened also, which indicates that there is still no features for acute cholecystitis. Here is the magnified view of the stone showing the hyperechogenic structure casting posterior acoustic shadow. So here's the still image of the stone casting posterior acoustic shadow. So a bright echogenic structure casting posterior acoustic shadow is noted at the neck of the gallbladder lumen, which doesn't move along the posture changing. Now the take-home message. The neck of the gallbladder is well visualized when you put the probe longitudinally at the right subcostal region or at the right lower intercostal spaces with a sound beam directing towards the gallbladder. This is a better scanning approach to see the neck region and you won't miss stone at that point. So thank you for watching. Subscribe to our YouTube channel for more videos. See you on the next one. Have a nice day.